We talked a lot about shortages in the last few years, but a shortage on paramedics rather is one that makes you perk up a little bit more. It's another issue that started during the pandemic that Arkansas is obviously still dealing with to this day. THV 11's Ian Russell shows us the reason why it isn't an easy fix.
You ready?
Breath and go.
Okay.
At Pulaski Tech,
Okay, very good.
the next generation of first responders are hard at work.
So for folks that really want an outside-the-box experience, that's kind of who we gravitate toward before they actually get out into the field and do it in real life.
Harold Schrey, program director for the Emergency Medical Services program, will tell you he's proud of the work these students do, but there's another emotion there: concern.
I don't know of any service in the state that is up to full capacity on employment.
That's because while we may have put the bulk of the pandemic behind us, the medical field, especially paramedics and EMTs, are still dealing with the issues it caused. Right now, there's more jobs available than applicants, but it's not just that. According to the Arkansas Ambulance Association, the number of people training to fill those jobs has seen a decline. Trey says part of the reason for that, this job just isn't easy.
Unfortunately, COVID has kind of taken a big hit with a lot of folks being wary of entering the medical field because they realize that repeated exposure to things put them at additional risk.
So I'm taking care of this patient in this tight, confined spot. I'm going to get off duty and I'm going to go home to my family who has been sheltering in place so they're not exposed. Well, did I just cause that to happen?
Greg Thompson is the executive director at MEMS. He's seen those staffing issues himself, saying the pandemic made many rethink their career, especially in the medical field.
You think about that time we're asking people to come on, hey, join us in EMS and go into strangers' homes and deal with COVID in the middle of the pandemic. So we did see a decline during that time of applicants for this work.
Thompson says recruiting and retaining those frontline workers took some changes. Raises, work-life balance, and better shift times were just some of the new policies put into place. But it wasn't just your typical benefits. MEMS also put a focus on their team and helping them work through the stress of the job.
We have been focusing for the last couple of years on mental health. We have doubled down on that. We actually have a therapist on site now. We've doubled down in that area.
While Thompson says he's starting to see more applicants, it may still take some time to see the end of this shortage.
Did you have good visual? Could you see everything?
To speed things up, some schools have even shortened the amount of time it takes to become a paramedic and EMT.
I wish there was a hard, quick answer for exactly when it's going to end. Academic institutions around the state have kind of revamped in what may have been 17 months previously of education, have figured out ways to get it more condensed into 12-month formats.
But they still don't have the students to fill those seats. And to get out of this situation, Trey says they need that to happen.
If we had, double the number of students, we could absolutely, accommodate that, and we could absolutely, push them out into a meaningful career.
In North Little Rock, Ian Russell, THV 11 News.